I went to pick up a turquoise necklace from a local jeweler a while back. Uh, I'd seen these beautiful stones in the store window, and I asked to have them strung together so that I could give my wife a nice birthday present. When I went to pick it up, the lady said, "Well, this is a certain amount of money," and it was a lot less than what I'd been quoted. I said, "Well, that doesn't sound right. It was supposed to be more." And she went and checked with the jeweler back in the back of the store and came back and said, "Well, actually, the jeweler was a patient of yours 9 years ago, and you helped her get off opioids, and she just was so grateful that she didn't want to charge you for the work that she put in." People do recover, and it's easy to forget that because we see so many stories about celebrities who have died from opioid overdose. But the reality is there are thousands and thousands of people recovering all the time from drug addiction, opioid use disorder. And that's why I wanted to write this book, because I worked for 40 years in the field of addiction. I ended up going to rehab myself back in 1984, and then went and did a fellowship in addiction medicine and decided that's what I would work in. And I loved working with people who have opioid use disorder. A lot of my doctor friends would say, "How could you work with those people? You know, they're just scumbags. They're not very nice. They don't think about other people. They're greedy. They don't care about anybody except themselves." And those doctors had certainly worked with a lot of people with opioid problems. And the difference though was that they were seeing people in the emergency room who were trying to get more drugs. They were lying and cheating and telling stories, and they weren't reliable. And so it was easy to think, well, okay, that's the way people with opioid use disorder are. But I saw people who were ready to change, who came to us because they wanted to change. They knew things were bad and they wanted something better. And we treated thousands and thousands of patients. And so I saw people get better all the time. And I would see people come back for follow-up 2 months later, 6 months later, a year later, 5 years later, and they were doing great. And they had gone from the pits of despair to be living happy, healthy lives. I'm thinking about a patient of mine, Jack, who he's a social worker now, and he's happily married. He's got a couple of stepkids and a couple of his own. And when I met him, all he could do was be looking for drugs 3 or 4 times a day and stealing things and stuff. And now here he is, a happy married man who's taking good care of himself and his family. And he's broken the cycle so that his kids won't have to grow up with the trauma that most people who have addiction grew up with. And that's why I like working with opioid addiction. That's why I've decided to write this book. There's so many questions that people have about how to get complete freedom from opioid use disorder. Do they go on methadone or Suboxone or naltrexone? Do they go to a halfway house? Do they go to an inpatient rehab? These are all great questions, and it's a complex subject. So I decided I would write a book from my years and years of experience to hopefully help more people make the best decisions of what's best for them, and also give them hope and motivation to get on with their lives and achieve complete freedom.